Have you ever heard of a lung disease linked to urine? It sounds unusual, right? Today, we're diving into a rare and fascinating condition called urinothorax, a condition where urine leaks into the pleural space, the area between the lungs and the chest wall. Get ready to explore its origins, how it affects the body, and what can be done about it. So, how exactly does urine end up where it shouldn't be? Urinothorax is almost always caused by some form of trauma or obstruction within the urinary system. The most common causes include obstructive uropathy, where a blockage prevents urine from flowing normally, and traumatic rupture of the urinary tract, perhaps from a car accident or surgery. Less frequent causes might include procedures like percutaneous nephrolithotomy, or even spontaneous ruptures in rare circumstances. Essentially, any situation that leads to a buildup of pressure and subsequent leakage of urine can, in theory, lead to urine entering the chest cavity. Now let's understand what happens when urine leaks into the pleural space. Urine is normally sterile, but it's also highly irritating to the pleura, the membranes that line the lungs and chest wall. The presence of urine triggers an inflammatory response. This inflammation causes fluid to accumulate in the pleural space, leading to a pleural effusion. The effusion compresses the lung, making it difficult to breathe. The chemical irritation from the urine, specifically its high urea and creatinine content, can also cause pleuritis, further exacerbating the inflammation and pain. Urinothorax is a very rare condition, because the underlying causes, such as urinary tract rupture or obstruction, are themselves relatively uncommon. Urinothorax is therefore very rarely encountered. There is no specific demographic that is particularly prone to it. It usually presents after some trauma or obstructive event in the urinary system, which can affect individuals of any age and background. The signs and symptoms of urinothorax can vary depending on the severity of the pleural effusion. The most common symptoms include shortness of breath, also known as dyspnea, chest pain, which can be sharp or dull and worsened by breathing, and a cough. Patients may also experience symptoms related to the underlying cause, such as flank pain associated with kidney stones or trauma. Sometimes, if the effusion develops slowly, the symptoms can be subtle and easily mistaken for other respiratory problems. Diagnosing urinothorax requires a combination of clinical suspicion, imaging, and fluid analysis. A chest X-ray or CT scan will typically reveal a pleural effusion, but to confirm it's urinothorax, a sample of the pleural fluid needs to be obtained through a procedure called thoracentesis. The fluid is then sent to the lab for analysis. Key indicators of urinothorax include a pleural fluid to serum creatinine ratio greater than 1.0, a pleural fluid creatinine level significantly higher than the serum creatinine, and a characteristic urine-like odor of the pleural fluid. Urinothorax isn't typically classified into distinct types, as the primary focus is on identifying and addressing the underlying cause of the urine leakage. However, it can be categorized based on the duration, acute versus chronic, or the volume of the effusion as small, moderate, or large. Regardless of categorization, the fundamental approach remains the same: drain the fluid and fix the leak. Treatment for urinothorax involves two main strategies: draining the pleural effusion and addressing the underlying cause of the urine leak. The pleural effusion is typically drained by inserting a chest tube, which allows the fluid to be removed continuously. The underlying cause, such as a ureteral obstruction or bladder rupture, will require specific interventions. This might involve surgery to repair the urinary tract, placing a stent to relieve an obstruction, or other procedures to restore normal urine flow. Antibiotics might be prescribed to prevent or treat secondary infections. Unfortunately, there's no specific way to directly prevent urinothorax, as it's usually the result of an unexpected event. However, steps can be taken to minimize the risk of urinary tract trauma, such as wearing seat belts in vehicles and taking precautions to prevent falls. Prompt diagnosis and treatment of urinary tract obstructions can also help prevent the build-up of pressure that can lead to rupture and subsequent urinothorax. The prognosis for urinothorax depends largely on the underlying cause and how quickly it's addressed. If the urine leak is identified and repaired promptly, and the pleural effusion is effectively drained, patients generally make a full recovery. However, delayed diagnosis or inadequate treatment can lead to complications such as empyema, which is an infection of the pleural space, prolonged lung compression, and even respiratory failure. While research specifically on urinothorax is limited due to its rarity, ongoing advancements in minimally invasive surgical techniques and diagnostic imaging continue to improve outcomes for patients with this unusual condition.